Hi, I'm Cat Oriel with Forbes Newsroom. Today we have Mark Newman, co-founder and CEO of healthcare startup Nomi Health. Mark, thank you for joining me today. So please tell me a little bit about your background and your path to starting and leading Nomi Health.
Great, thanks for having me. Yeah, Nomi Health is the leading direct healthcare company in America. We take a model through technology and care delivery to rebuild what we think is the sickest patient on the planet. That's the U.S. healthcare system. So when we go after that, taking together all the backgrounds of myself and my partners, I built a company called HireView before this for 13 years, which is the leading provider of video-based job interviews, assessments, machine learning, and AI for large enterprise employers. So that's the employer angle. My two other co-founders came from running a company called Nomi Health, which was the first narrow network plan provider for self-funded employers, and the chief digital officer at Goldman Sachs, Bo Hartman, who built out Card and Marcus there, and a few other organizations before that. So we wanted to combine together employer, healthcare, and fintech expertise to rebuild this system.
And so what specifically does your company do?
We deliver a direct healthcare model to any self-funded employer or state or local entity, or who are the real buyers of healthcare in America. We want to equip the buyers to be able to buy care directly from providers. We want to build a new infrastructure and deliver a new infrastructure that runs all that in real time. So we know what happens now, how to pay providers now, how to figure out next best action for the member. And then we have a care delivery side of our organization as the physical manifestation of direct healthcare. We focus on everyday basic healthcare, right? Whether that's at home, virtual, or in person in large kind of public health settings, or running large population care programs. And then we, frankly, celebrate the provider. We work with lots of health systems and other doctors' offices to get the care that we need to the members that we serve in an easy and low-cost way.
And your company stands for No Middleman Healthcare. Who do you think is the middleman when it comes to healthcare that you're trying to eliminate?
Yeah, unfortunately in healthcare, in the US health system, it's not one. It seems like it's 800 different layers of cost and noise and ambiguity. I mean, the fact of the matter is for $1 of negotiated healthcare, right, that each of us get as a patient, or after we go to a doctor's office and we get our bill, the employer or the state or the local entity that we serve actually pays $1.20 to $1.30 for it, right? With medical loss ratios, administrative fees, all the overhead that you pay for inside of your plan. And the provider that you get it from maybe collects 75 cents after patient collection fees and write-offs and revenue cycle management and collections and all sorts of silly things that happen as it relates to getting paid for delivering care to members that you have. And so for us, that's what we look at as the middleman. For the fact that it costs one entity $1.25 for $1 of healthcare, that the person who provides it gets 75 cents. And we just need to crush that. Because if we crush that to saying, hey, provider, let's pay you now, let's deliver this now, let's access it now, that adds up to almost $1 trillion of savings for the US economy. We think we can be spent on better things.
And one of your company's taglines is, it's time to rewire our healthcare system because it is fundamentally broken. And what exactly do you mean when you say it is broken? All of it, or is there specific parts that you think are specifically broken and in need of repair?
I think we have the best doctors in the world here in our country. We have the best health systems. We have the best, the hospitals, the technology, you name it. But the idea that any organization delivers care to somebody and has to spend 2 to 9 months to figure out how to get paid for it, and they don't know what they're going to get paid, and how they're going to get paid, and when they're going to get paid, right? Let alone like that system. I think of it as it's so archaic that like in our personal lives, we book a flight to Miami and it comes up with a rental car and a hotel for the same day, same place, right? In our healthcare lives, if we booked a flight to Miami, you come up with a rental car in New York and a hotel 6 months later. Like we wonder why our system costs so much. First off, no one knows what's going on next. And second, the people that deliver the care have no idea how to get paid for it. And so that's not going to fix itself by like duct taping a current broken infrastructure. We saw it melt down during the pandemic. It's not getting any better. And so as a result, we want to build a new model, a new infrastructure, a new rewiring, right, of the system that connects buyers and providers directly and really empowers patients to get the best care that they actually can afford and access. And that's our approach.
Is there another country that you believe their healthcare system is doing a lot better job than the US that you think we should be trying to emulate?
The thing that I think the U.S. can emulate from other countries is clarity of payment, the business, like the business model of healthcare, clarity of activity, and next step. Right? When it's a single payer system, which I don't think is the right model for America, you at least get the efficiency of one single source of truth, one thing that's going on, and what's happening next. So that's what we do need to emulate: is the simplicity, right? The administrative costs, the higher value, the easier, lower cost way to run the whole thing. Imagine if we have a health system in America, though, that has the efficiency of like the most efficient of medical systems run in other countries, with the quality that we know our health system can deliver. I think we go from number 30 in the rankings, right, of healthcare system quality to number 1 almost.
Going back to what your company did at the forefront of COVID testing and vaccinations, how did you get involved in that? And how did you identify that need and step up to the plate at the start of the pandemic?
There was a day there was one day right at the beginning of the pandemic when the president had announced, "Oh, I'm with the major retailers. Turns out we're going to launch testing sites in thousands of locations. They've got this. We'll be fine." And we actually had an executive from one of those retailers at our office, and I said, "So it's heard you're saving the day." And they said, "Actually, can I tell you the secret about healthcare retail?" And I'm like, "What's that?" They go, "We don't want sick people coming into our stores." And so first off, set the table of, we're not in a good place, right? This is not actually happening. This is not moving forward. But more importantly, we observed an insight, and that was this. There's not a business model in healthcare for building trust in the world around, which is what we were all trying to do at the beginning of the pandemic, right? We were terrified of this thing, of COVID. We were wiping down our groceries, wiping down our packages, things like that, right? So as a result, payers didn't want to pay for testing because they only want to pay for symptomatic patients that were, that they believed had to get diagnosed, which resulted in the fact that providers then didn't have a business model for it, which then meant that the organizations underneath these providers weren't going to go and buy supplies for something that had zero demand previously, and they were trying to predict what the future was. And even if they did, your typical healthcare organization only calls one of 3 sources to say, "Do you have tests?" And we all remember that feeling in the beginning of March of 2020 when everyone said, "There's no tests, there's no tests, there's no tests." Well, no, it was because that triad of failure, right? Of payers don't want to pay for it, so providers don't have a business model for it, and then like the people running those systems couldn't find it because they can only go buy supplies from 3 approved sources who didn't have it, is why the system melted down. And so for us, we said, listen, we're a direct healthcare company. We've observed these things. Turns out you can access supplies. We have them. We have them here in Utah, actually. Turns out the system needs to be, technology-driven, digital sharing of results, really super easy. And if we scale it up in a really big way, we can do it for such a low unit cost because we don't collect insurance. We don't wait for people to pay for it or whatever, right? And we raised our hand and said, this should be set up in Utah. And then got asked to set that up in Utah. And everyone said, COVID's going to be over in 45 days. Just set it up. We'll be and 2.5 years later, we've served 50 million. And our direct model works. In the states that we serve, like Utah, Iowa, Nebraska, and Florida, they're recognized by the National Bureau of Economic Research as number 1, number 2, number 6, and number 11 in the country for COVID response. And that's because we drove open and ubiquitous testing to build trust in the world around you, right? So anyone could get a test anytime. And when you did that with no friction, turns out that test could be $30 instead of $100 or $150 or $200. That would end up happening in what we call claim by claim healthcare. And so we did that. We started it. We launched it. None of us thought COVID would keep going for as long as we did, but it's been the honor of a lifetime to serve the communities that we've been able to serve, and the results speak for themselves.
So you started out in Utah, and then what was the process in expanding across the country?
If we all remember spring of 2020, every state got told the wrong stuff, which was both the right move and the wrong move, right? All at the same time, right? Meaning like wrong move in the sense that there was no federal approach to solving this problem, right? Right move in the sense that it empowered local control to go solve it because people that knew their communities, their ecosystems. And so it started in Utah, and within a couple of weeks later, we were in Iowa and Nebraska, because, same size type of state, same type of footprint, mix of urban and rural. And our goal at that point in time was, let's equip states to be self-sufficient in what they're trying to do and how they're trying to do it. So we built labs and partnerships with the states in their own in their own state labs or partner entities. We got them full supply chain, technology, playbook, right? This is how it went and worked. As this thing went on, our role evolved from supplying kind of as a general contractor, all those things, to becoming program operator, right? Where they want us to do nurses and the collectors and all that kind of various stuff. And then as we emerged in the fall of 2020, it was, this thing's still going, why don't you go take it? And so we actually evolved to a full operator model. We're now jumping forward to 2022, we're the whole public health, whole system public health operator in a lot of locations around the country. And and who we want to serve are the underserved, the people that before the pandemic, healthcare access was terrible, and post-pandemic it's even worse. And so as a result, we have a real honor and an opportunity to serve in hard-hit urban areas and under-accessed, underserved areas across the country, and that's our role to play.
Do you think there's a reason why your startup has been so successful in predominantly red states and those led by Republican leaders, or is that just a coincidence?
We think it was more of a coincidence than not. But what we found was, outside of red or blue, the states that we were successful in were actually states that had a deep experience dealing with natural disasters. Because and what we found was that in the pandemic, you had two types of healthcare, two types of response. You had states, red or blue, that said pandemic equals healthcare problem, which equals healthcare response, right? Which was health system driven. And then you had a whole host of other states that said pandemic equals natural disaster, which equates to emergency management response, right? So if you're a state that deals with tornadoes, hurricanes, floods, derechos, you name it, you can't name the storm, right? Like if you think about, let's use Florida versus New York as an example. In New York, you can still talk about Hurricane Sandy from 10 years ago. In Florida, they get hit by so many hurricanes, they can't remember the names of hurricanes the next season. But so that also then goes counter to their DNA of, listen, if a category 4 hurricane hits us, but we reopen in 48 hours, why would we let a pandemic stop us? And, there was a time in Iowa, for instance, where a derecho came through and just decimated crops and picked up our sites and crashed them down, making them look like a plane crash site. And the emergency management leader looked at us and said, great, you have 24 hours to reopen. And so what we found, is a couple of things. It wasn't red or blue. It was, first off, a market dynamic of kind of fragmented healthcare systems were trying to figure out how they were running and staying in business. And so they were kind of, they all got called, so then they needed a solid approach. It was communities with a lot of people that were underserved, whether that's rural, whether that's, kind of distributed urban, or you name it. And then third, it was an operating mentality, not a political party that we ended up aligning with. So it was the people that got hit by hurricanes, floods, storms, and other things like that, that we just saw the same world with, and went and solved the problem in that way.
Got it. And so not only were you at the forefront of COVID, you've also been doing a lot of research into long COVID. And so tell me about, and its impact in the workplace. So tell me a little bit about what your research has found. And just to clarify, how do you define long COVID? What exactly does that mean? And just tell me about what your research has found about the economic impact of long COVID.
Yeah, most definitely. So as we described before, Nomi is not just a COVID company, right? In our care business, we supported a lot of public health and COVID work, but it also gave us a kind of front row seat. We've had 2 to 3 million people diagnosed with COVID through our platform over the last couple of years, and as a result, can kind of see a lot going on here. How often people get COVID, how often the same people test positive, things like that. We marry that with that we also partnered and acquired Nomi Health, which is the leading analytics platform for self-funded plans. So you can imagine now that we can combine the largest analytics platform for self-funded healthcare with this data set of activity to really glean some fascinating insight. And so the way we define long COVID is we actually didn't look to make our own definition. We followed people who received a diagnosis of long COVID. which is already still in its infancy of trying to be figured out what that means, right? So we weren't trying to come up with what it is, but it's the demonstration of ongoing symptoms, 1 month past as we go down. We then were able to pull that across our data set of 20 million people that we analyzed their healthcare data across, whether it's for geography, work style, you name it, all employer data. And what we found was that there was a 200% increase in medical spending per month for somebody diagnosed with long COVID versus the baseline. That was really interesting to us, right? So then you start figuring out who looks like that other person. There was a 400% increase in hospital spend. There was a 100% increase in diagnostics. And what we uncovered in this was that patients with long COVID are stuck meandering through the health system, right? Because there isn't an answer, there isn't a pathway, there isn't clarity to kind of what to do and how to do it. And so what we found is they're wanderers, right? They test positive for COVID. A month later, 2 months later, they still feel terrible, right? And they start wandering through the health system trying to figure that out. And what this cost is in terms of how it's affecting the employer base is actually more than the cost of managing diabetes in the workplace. So we think pre-COVID, we always thought of the big five as the main cost drivers for employer healthcare costs, right? Heart disease, cancer, MSK, diabetes, et cetera. Well, COVID's reared its head as number 6. We now have, a new condition, long COVID, which is real, affecting a pretty significant part of the workforce, right? Somewhere around 10, 15% of the workforce at any given time. And the cost of managing that is more than the cost of managing, a diabetic in your workforce. So we have a real problem on our hands, and we think it's going to get worse. Forget that.
And so, what do you plan to do in terms of treating this and preventing long COVID to begin with, if anything?
Yeah, so preventing long COVID comes right back to your original diagnosis, right? And like how you're doing it, how you're supporting it, how you're getting through it all. For people that are still experiencing symptoms, what we first want to do is support them with like an actual care management and navigation pathway, right? Again, the first problem is the wandering in the health system. We've all been there. What's going on with me? I don't know. Right? Research is already showing that there's 70 different symptoms of long COVID, right? Like there has to be something that kind of brings that together. And we believe that has to be done at scale and not one-off in local areas or with clinics or you name it. And frankly, employers and states and public entities are looking for that broader care management offering that's that's the navigator to help get people access. The second part is then figuring out where they should get access and how they should get access. A lot of it can be done at home. Some of it can be done in centers. Other things, can be done this way. And again, how do you scale it, make it repeatable, and bring a playbook to the fact of like, how do we uncover what's going on? How do we understand the symptoms that you're experiencing? Great. Then the third, how do we now do something about it, right? There's a lot of wonderful research going on. Everything from if you get a genetic, we've seen everything from if you understand what variant you had, you could map that with either the vaccine or the monoclonal treatment, right, to mitigate COVID stuff. That's early research there. Who knows? You've seen some of the addiction treatment drugs that are coming out right now, right, that supposedly have some effect on it. And so, for the ending of long COVID or the care pathway model of long COVID, we want to partner with the leading research organizations to say, here are people who have tested positive, here is their history, here is where we've navigated it, where we've understood what's going on, help stop the wandering, right, on here. Now, here's the baseline belief around like what would help them most, and here's best in the world at going into that. And we're partnering with more and more healthcare organizations.
So do you support the CDC recommending just yesterday that COVID boosters and vaccines should be added to the yearly immunization schedules?
That's going to be, yes, the CDC is trying to, bring a great approach to the programmatic delivery of healthcare, right? But the broader public has trouble with is what then becomes like recommendations, guidance, or mandates, right? In terms of figuring that part out. And I think that's the next step that we're going to have to navigate. Kind of just finish chapter 1 of that, right? Through vaccine requirements and all these kind of worlds. And then we're getting to chapter 2. because there's always this question of like, what does it mean to be fully vaccinated, which is what we're trying to address, right? So if someone chose not to, how do they catch up? Do they have to get every booster? Is it not this? How many boosters are we going to need, right? And so what I think we have to make sure is that we are recommending, right? We are trying to support people to be on their best path. We are learning that, but that like it may not be, hard and fast because we don't quite know that future yet. Like we've had enough time in history past to know the right pathway for polio, right? The right pathway for TB, the right pathway for other vaccine schedules. We're still figuring out this one, right? Around boosters and you name it. So what we recommend to people is, healthcare is personal and take care of yourself. And we definitely recommend, the vaccine program as you go along with it. And, to do what's right for you and your family as you go along on it.
Do you think that's why the vaccination rate for the Omicron booster has been so low? Is it also partially a messaging issue from the Biden administration?
Oh, absolutely. I think the vaccine adoption rate has been low because of, there's been, remember last year on July 4th, we said it's Independence Day from COVID, and then we went through Delta and Omicron, right? At one point in time, it said if you're vaccinated, you'll never get COVID, and that got true, right? And so as a result, like I think there needs to be a pivot on the message of like we are going to empower people to take healthcare into their own hands, to be able to do what they can to mitigate their risk to go do this, and that you should go and do it, right? And you should go after it, and keep the message going and keep pushing it to be able to kind of bring it on. I think a lot of America got really burned out last year around the us versus them messaging that was happening around like there's the battle of the vaccinated and unvaccinated and all that stuff, right? That's really hard, and whether you're on one side or the other, you just get burned out, right? And so now it was like, well, you said this was always going to work, and now it's not, and now we have to do boosters, and then we have to do another booster. Like, I think what it is that the community is confused. They don't know what's right. They don't know what the right path is. And so it's easier, frankly, like most healthcare things, when we know something will make us healthier. We know exercising more will be good for us. We know not smoking will be better for us. Right? We know this thing. We have to be really careful that COVID vaccine doesn't fall into that thing. I'm sure I could get another booster and be fine, but at a certain point, I just don't know what to do, right? And we're on that precipice. Yeah, we do need to pivot the message to get back on the right track.
And so what would your message be to lawmakers in DC about COVID, about long COVID, especially as the pandemic moves into becoming endemic, and also as COVID funding seems to be dwindling?
Yeah, my message to lawmakers would be really simple. Do your job. What your job is actually meant to do is to figure out programs that work for the communities that you serve. The amount of ineptness demonstrated on a regular basis around like aligning on like or recognizing of there needs to be resources to solve this problem, right? Let's agree to that. Now let's figure out what the right path is. And instead, like watching politicians kick sand on each other like sixth grade, like kindergartners in a sandbox around no more money or this or, oh, you're wasting it here or whatever. Pathetic. It's infuriating to the public. It's infuriating to the providers who raise their hand to like drop everything to support the public in going into this. And it's just a demonstration of typical Washington ineptness on a regular basis. So our message to politicians is one: stop spiking the football, because every time you spike the football, you are so far off from the end zone. I mean, we've seen this every single time it's been declared either COVID is over or this is Independence Day or this thing is going to be great or whatever. Unfortunately, we're still in like two or three of COVID and figuring out what is happening. And as a result, so it's like accept reality. We need to have a playbook. We need to go, and manage this aggressively, right, as we go and do it. And there's a better way to do it than what we are doing, right? I mean, you saw it yesterday as well with Pfizer announcing that, the claim by claim approach to the vaccine, meaning, a direct healthcare model, if you think about it on the vaccine, was the government buying 100 million doses, right, at a really low unit cost because they had the doses and they could focus on distribution and getting shots in arms. And now we're going to go to this commercialization of COVID where you're putting it, you're taking what was a good process and throwing it into the most dysfunctional system in the world, which is the U.S. healthcare system, dealing with insurance companies and PBMs and the whole bit. And so, yeah, the cost is going to go up. And then someone's going to say, who has to pay for it? And then how do you do copays? And how do you do deductibles? And how do you do all these silly things that, we're not going to get better results next year, in terms of tackling COVID. It's actually going to get worse. And so do your job, get aligned on a strategy, get aligned on resources, and get it out there. Understand that there's a way to do it at a lower cost if you're smart about it. And stop fighting like children. But I think that's the issue on I think that's the case on lots of issues.
Definitely. Well, thank you. Is there anything else you would like to add before we wrap up today?
What I would suggest, for everybody, especially as it relates, is two things. One, COVID is real. We've lost millions of people to it in our country, and it's really affected the people around us. And you're seeing long COVID now raging its kind of ugly head. And just bring compassion to it, right? You know what I mean? It's like there's a large group of us that have, fortunate to have not had someone in our lives die of COVID. And then there's a whole lot of people that have lost numerous family members and cousins and uncles and aunts and things like that too. And so as we talk about that, let's dial it down. Let's have some compassion, right? And actually have a discussion and accept reality. This is a thing, we need to do something about it. But the second part is we don't have to accept that healthcare should cost as much as it does. We don't have to accept that, access should be as bad as it is. We don't have to accept that the healthcare system should be allowed to increase its costs $300 billion a year now and not do anything about it. There is a better way. Nomi hopes to be part of that or lead that, but there's lots of other organizations that are raising their hand to say, let's do that too. And coming out of the pandemic, we saw the darkest of the dark in America, right? And now we can see, fortunately, the lightest of the light. And one of the things we should do is require a rebuild of the health system.